Prof, good morning to you once again. So let's get to it and let's look at these key provinces, and especially with what's happening now. If we look at Gauteng overtaking the Eastern Cape, let's look at the epi curve and what it's telling us.
Yeah, so I think the epi curve, certainly helps us put things in perspective rather than just reporting the numbers, because again, I'm not clear what those numbers mean. They just simply are accumulation of cases. But if you look at the epi curve, and if you look at the bottom of the epi curve, especially the blue area, which is Gauteng, and you can see that as we look at the onset of symptoms or dates of testing, you can certainly see a marked increase in terms of the numbers of cases that we are currently seeing in Gauteng. Obviously, the Western Cape has dominated that, and you can see the waves of infection that are still markedly high in the Western Cape. And you can just see a bit, I'm sure the colors may not be obvious, but you can see something similar with the Eastern Cape, but I think it's more obvious when you look at the Gauteng, for example, that there's a marked increase in the cases as the lockdowns have graded from 5 down to 3 now.
Does the curve give us any idea as to what might be the problem then? Why this would happen in those specific provinces? What is unique to these provinces that's showing us those numbers?
Yes, I think the key things, again, are coming back to, as we've stepped down with the lockdown, you can see that the effective R for the country, that's the reproductive number for the country, has always been above 1. So it's always been 1.3, 1.7. So we certainly are seeing the increases, but obviously in specific areas, perhaps, we're seeing greater seeding and greater transmission. And so it comes back to those key things that we keep on talking about on your show and all other media, is that really the physical distancing, the hand hygiene, cough etiquette, these are still the key things that we must still implement and continue to implement as we progress through this epidemic. Again, I'm sure as we've seen about 8 million or more people has moved around since that level 3, and that the closer the distances, the bigger the crowds, the more likely we are going to see these particular outbreaks. I think it would be useful to see a more, if you like, granular assessment of where we are with the different districts and sub-districts to really get a sense of what's happening at those particular levels.
So, Prof, to that note then, and just going back to what the Health Minister has been saying about a shift in their mass screening approach, saying that they will now focus more on screening and testing in hotspots, would that go some way towards flattening the curve? Good move, bad move? Your thoughts?
I think we've been talking about this for a long time, so I'm pleased that the Minister has committed himself to that. I think it's really key, because you can see as we look at the numbers that you're looking at on your charts, the actual number of positives per 100,000 is actually now between 5 and 10%. So that's not really, the chances of you finding someone that's positive is high. So you really need to expand your testing. That's really critical, as well as ensuring that you're focusing on the key areas such as the hospitals, the clinics, and outbreaks to really get a better sense of how the epidemic is actually progressing. I think what is important, though, is to link this to the hospitalization data. So about just over 2,000 people are in hospital, and about 400 are in high care. And our case fatality rate is about 2%. So that has stayed relatively stable thus far.
And let's just talk quickly about what would typically have been influenza season at this point. I'm not sure what we're going to see after this cold spell that most of the country has fallen victim to. So influenza season, are we seeing, or the lack of, the absence, what's been the impact of that and where we stand with that?
So far that's been very helpful, that the flu season has actually been deferred. But I think, as we've spoken about, we've closed our borders, we've introduced the lockdown, we're still continuing as far as possible the physical distancing. So those, I think, are certainly, key contributors to the fact that we're seeing a deferred flu season, and also the respiratory syncytial virus season as well. It's also certainly been deferred. So I think those are good things. But as you said, the cold spell comes along, people come together, so that may be a way in which we could see cases. But I'm hoping if we continue with these public service messages, we can certainly try and manage matters.
Okay, we'll leave it there for now. Thanks very much, Adrian Puren there from the NICD, giving us our daily updates and what we're seeing in terms of those numbers and breaking them down for us.